It looks like you lost another one.
To the Buffalo Center for Health Equity for putting this conference on. Every time I come here, I learn something new that I can take back to my people and my community and educate them. Shout out to UB for hosting dynamic presenters today. Shout out to Stan Myrick Consultant, that's my man with No Menthol Buffalo, my man Sherb on the video, man. Shout out to all y'all. Thank you. Isaiah Gary here with Catholic Health. Had a phenomenal time at the conference today. All right, so I attended 2 sessions. One was on maternal health, so I went to that session, and then I went to the session on housing with Dr. Taylor. Anytime Dr. Taylor is talking, I have to be in the room, so I had to go check out Dr. Taylor. Shout out to him. Oh man, so one thing that came up was cooking with a gas stove. I didn't know this. Cooking with a gas stove lets off toxins and pollution, right? So the takeaway from that was I need to get an electric stove and maybe fry food a little bit less. Something that I wasn't so excited about that was interesting was she said, you know, if, for example, your woman or wife or whoever was pregnant, that maybe the man should do more of the cooking if you're frying food. I'm like, dang, I don't even cook like that, but okay, you know, I'm cool with it. Opening the windows for ventilation and having a good ventilation system when you're frying food and using an electric stove. So that was powerful. As far as Dr. Taylor, you know, he always talks about how there's a wealth extraction and how people are taking money out of our communities. A lot of ideas around housing. He did say, you know, what's just flipped it for me kind of was that we don't have a housing crisis. I'm like, wait a minute, man. Yeah, it's a housing crisis. But he was saying, like, you know, the system is functioning the way it's supposed to, you know, and how, like, housing and Clarence can't be housing in Clarence if housing in Buffalo isn't housing in Buffalo, and how it's a racist system, is designed this way. So a lot of takeouts about housing around that. It was dope. It was definitely a dope presentation.
So my name is Carlos Jose Calderon Jr., and I'm here today as part of the University at Buffalo's Food Lab, or Food Systems Planning and Healthy Communities Lab. So I actually presented today. Yeah, so this was the section I presented in, which is food systems. I specifically presented on urban agriculture and its connection to health. What I focus on specifically is mental health. So being an East Side resident all my life, I have faced personal trauma and stress in food acquisition. And when the shooting happened, that hit something very, very deep within my soul. And it continues to do so even to this day, and I can speak for myself and many others. And so to highlight mental health as part of the overall conversation on health, and especially in relation to how we get our food, how we grow our food, what we eat, how it affects our health, it's very interesting to include all those things together. I would say when you are looking into social issues, look much deeper into what the first Google search will give you. And also come to UB Food Lab. We're in 233 Hayes Hall. Our door is always open. I will most likely be there because I work crazy hours. And then you can ask us more information.
My name is Tamara Cross, and I'm a first-year medical student at UB, Jacobs School of Medicine and Biomedical Sciences. Sure. Well, firstly, I thought I would be so overwhelmed and consumed with my studying, but I made time to come down. I've actually been involved with the Igniting Hope Conference since I was a junior in undergrad, so 2019. I've been scribing and reporting out from the small breakout sessions. So it's just always been refreshing for me to be able to be surrounded by like-minded individuals who want actionable items to combat health inequities, health disparities in our communities. And I think that's something that is often overlooked, especially prior to the pandemic. A lot of people weren't really thinking about health disparities, but there were specific pockets in the community that were always thinking. And once we came together, it was just a powerful experience. So I am just always grateful to be able to be surrounded by like-minded individuals working toward a common goal of creating a better Buffalo. So I was able to go to some of the breakout sessions for the workforce development with the Buffalo Center for Health Equity, which wouldn't have been my first particular choice, but I decided this year as a participant rather than an organizer or volunteer, if you will, to kind of broaden my knowledge and go to a breakout session that might not be directly in my field of medicine, if you will. So having the opportunity to learn more about workforce development, the different organizations that the Buffalo Center for Health Equity are working with to meet the needs of community members so that they can have better opportunities to achieve their best health outcomes through finding better work positions, finding different work outcomes, different things that will help them to create the lives that they want to see. So that was inspirational for me. Like I said, it wouldn't have been something that I normally would have gone toward, considering how I'm interested in primary care. But then I realized as a primary care physician, I'll have to look at other things that are contributing to people's health, like their work experiences, like their transportation needs, like their food needs. So it was an awesome experience.
My name is Kelly Baker. I am brand new to Buffalo, actually. I just joined the University at Buffalo as a professor and the director of a new Center for Climate Change and Health Equity. So the center is housed in the School of Public Health and Health Professions, but our aspiration is to be a resource for everyone that's interested in the climate change and health equity topic, whether you are at UB, in the community, a policymaker, an organization, a business. So we it's our first time attending the conference, and we have learned a lot. It's been great to hear about all of the inspiring work that's happening across the Western New York area. Sessions, that's actually an area where I do some research. Some of the aspects that I learned about in this session were about ongoing projects in the school that our people are doing research on, like air pollution as well as smoking cessation. Since I'm new, it's all about learning what's going on. But I also got to hear about some of the really cool community outreach around those topics, like the perinatal network and all of the door-to-door type of work that they do, intimately working with mothers, both pregnant and new ones, to help them address housing issues, food issues, healthcare access issues. It was really inspiring hearing about the perinatal network.
I'm Jen McCosey. I am the West District School Board member for the Buffalo Public Schools, but first and foremost, I'm a parent and a grandparent within the city of Buffalo. I attended this session on maternal health and also the food systems session. I kind of had to break up in between both of those, but it's staggering how the main I believe issues with all of those is communication amongst everything and everyone in this city, from government to community to university. We all come together. We all recognize there's a communication issue, but now after this, I'm hoping the follow-up is real, because you had community members, you had academia, you had faith, you had everybody here. And that does nothing but help the Buffalo Public Schools, because all of our folks in the community are tied to all of those communities, and all these issues are real. This is the third most impoverished city in the country, second largest city in the state, and there's so many ideas that folks at the tables had. So I'm hoping we can all benefit from that, and BPS has got to get on the ball to make sure we connect with all these folks. I didn't know what role to play. There were so many concerns that addressed me personally, that addressed me as an elected official, that addressed me as just a community leader. So I'm really hoping that if people don't start talking to each other, that they realize I'm going to start talking to them, and we're going to make it happen.
Hi, my name is Ellen Harris Harvey.
And my name is Maxine Hall.
Absolutely important for our Buffalo community, especially the east side of Buffalo, where, it's a lot of black and brown people in that area. We need environmental justice, and we need people to understand what this means for our community, to be highlighting these type of issues that would bring change to our community.
And we also needed for all the communities to come together. And even though we are in the black and brown community, we need to make a decision to work together as a positive type situation, more so than being at odds with one another, which a lot of times we don't work together as we should.
Amen.
So
yes,
that's what I think is very important, and for our total country.
It's been such a collaborative experience listening to all the presenters and the organizations that came together to talk about environmental justice and what this means for the Buffalo community and the county, and how all the public officials are stepping up to make sure that they highlight this issue so people in the communities know how important it is for us to come together.
That's the only way you can achieve anything, is we all have to be on the same. We can disagree, but we have to get on the same page to come to a balance. Life is about a balance, and
Yes.
sometimes we're not doing that.
We're better
Yeah.
together. And that's one thing about this country. We've been so divided and so much divisiveness in the atmosphere and the climate of politics right now. This is a way for people to see that we are still coming together in our communities, in the grassroots. That's where it has to happen. It has to happen from the ground up. It never happens from the top down.
And we have to use the brain that God has given us. And when you do that and ask for His wisdom and His knowledge for you to make certain decisions for not only you, but for someone else. Don't be saying what I want when it comes to what goes on in the community and in the politics. Because when we get to the point where we are just me or I, or
Yes.
I can fix it, no. Communities, it takes a village
Yes.
to make things complete. in
I
our
like what you
world.
said. It's not what I want, it's what we need.
Exactly.
I'm Dr. Tim Murphy, and I'm director of the UB Community Health Equity Research Institute, and I'm one of the organizers of the Igniting Hope Conference series. So the Igniting Hope Conference brings in community folks, community leaders, community members, and working and talking with university faculty and students and staff. And so it's important to have this continuity where we meet every year, and the breakout groups have great discussions among many different stakeholders and many different people who are committed to this work. So the consistency each year is important. And I'll just add one more thing to that, and that is that we're now in our 7th year, and the discussions have evolved. In the beginning, we were really talking about what's the problem? What are the problems, and what do we need to put our energy into? And I think now we have learned a lot about what the problems are, and we're to the stage where we need to talk more and more about solutions, and that's exactly what's happening at this conference this year especially. I think my favorite part of the conference is the tremendous passion that people have, the people who are here, and those people are representing diverse interests, if you will. It's community members, it's people who live in the conditions that we're trying to change. It's community leaders who have influence over that. It's university researchers who want to try and figure out ways to solve the problems that exist, and then it's students who want to learn and also want to contribute. So it's that commitment and the passion of all these different people with a common goal.